nutrition, 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 nutrition.
Welcome everybody to this event. My name is Sylvester Moyo. I am the founding dean of the Faculty of Health and Applied Sciences at NUST. I'm going to take you through the journey of building capacity around health and nutrition security in Namibia. The journey that I'm going to take you through is to give you a rundown of how programs were started at NUST in allied health professions and science as such. In 2008, programs in science were started at the Polytechnic of Namibia. And the first two programs that started were biomedical sciences and environmental health sciences. But since there was no faculty, they were housed in engineering. I personally was recruited to initiate or to run the programs in 2009, but I only started working in 2010. I was supposed to have joined Polytechnic of Namibia on the 1st of January, but due to visa issues, I only started on the 1st of March, 2010. Now, after I joined, the faculty was not created yet. And in April of 2010, the faculty, which was then known as the School of Health and Applied Sciences, was created. And I was appointed the founding dean on the 1st of May, 2010. At that time, there were only 4 programs. I have already mentioned environmental health sciences and biomedical sciences. The other program that was brought on board was emergency medical care, which started in 2010, January of 2010, just before I arrived. And yet there was another program that had been running for a while, again under engineering, which was mathematics and statistics. So when I became the founding dean, there were 4 programs that were running at the Polytechnic of Namibia under the School of Health and Applied Sciences. So it was biomedical sciences, environmental health sciences, emergency medical care, and mathematics and statistics. So these were the initial programs. So there was a lot of work to do. These programs had just started, they needed a lot of support. Support that was required was in varying areas. Staffing was an issue, facilities were an issue, industry partnership was an issue for work integrated learning, and also, but we had a very strong, shall I say, positive thing that we had very good international partnerships. We had a partnership with CPUT, Cape Peninsula University of Technology in South Africa, and Arkansas Medical School in the United States of America. And I remember very well that one of our programs was ready to start with the WIL program, Work Integrated Learning. But guess what? From day one, when our students came to the program, until that time that they were ready or almost ready to go to industry, they had not been in the laboratory. And it's a laboratory-based program. And can you imagine unleashing them to industry without any laboratory background? So we talked to our partners, international partners. CPUT sent a team. Arkansas from the US sent a team. And we took the students through a crash program for them to be able to be ready to go to industry. And it worked very, very well for us. So that was really a very, very helpful hand for us moving forward. The other thing that we had to think of now is, what other programs are we going to have? We have 4 programs running. Is that all? Certainly not. We knew that Namibia needed more. So there was a lot of work ahead. So we went through planning. And what did we do? We had comprehensive discussions with all major stakeholders. And of course, top on the list was the Minister of Health and Social Services, and all other relevant ministries and major stakeholders, just to find out what programs we needed. So we went through a list, a process of trying to establish which programs are important for Namibia. Where do we need to go? Where do we need to put our efforts to produce the required manpower? It was very, very rewarding. We came, with a list of programs that we thought should be started at NAST. Of course, we already have that, the 4 that I've already mentioned. Then added to the list was natural and applied sciences. Now, natural and applied sciences, these are the basic sciences, the biology, physics, and chemistry, which you need to understand science in general. And without them, you can't start biomedical sciences or environmental health sciences. So we needed to have such programs started at NAST. There was nothing at the time that we started the faculty. Then, of course, we also had to come up with honors programs, because in mathematics and statistics, because there was only one program offered at the time, which was a bachelor in mathematics and statistics. Now, we needed honors programs in applied mathematics and applied statistics. And that's exactly the direction we went. We also came up with, through interaction with industry, health information systems and management. And this program was really, we felt it was really required, because the Ministry of Health and Social Services was going through a phase whereby they had to use health professionals, in varying disciplines to do this work. And most of them had not received enough training, to the extent that we realized that we also needed to help them out. So we actually came up with 2 programs where we came up with a postgraduate diploma targeting the people that are already in industry, so that we could lift them up, and also a bachelor program to produce more of the desired. So that was the other program that was identified. And guess what? We also came up with human nutrition. And I stand here today to go through this, but at the end of my talk, I will zero it in on human nutrition. We also identified one area which unfortunately we couldn't go into, which was sports science. The problem we ran into is that, as you are all aware, NAST is a city campus. There are no playing fields. And to run a program like that without having the playing fields was an issue, so we shelved that one. But out of all the programs that we planned, the undergraduate program that we planned, we were able to accomplish them all. I'm just talking about undergraduate. I'll go to postgraduate in a little while. So we took these in order of priority, and we started running them accordingly, and we achieved all that we had planned. And I'm glad to say that I had a very committed team that I worked with. Being dean, if you don't have people to work with that are geared to do the work, it becomes very heavy. But I must tell you this, that I had a very committed group of people. We worked very well together, and we managed to achieve. Then we also started planning postgraduate programs. One of them was a diploma in radiation science, which we actually devised with the Uranium Institute, and they sponsored the entire class of the first students in this program. And we also obviously then started the diploma in health information systems and management, as I said, and then of course the master's programs in maths and stats, which started much earlier because they were already on. We already had students that had graduated, so all we needed to do is just roll it out. And the students were already there. Then we also came up with a master's degree in applied statistics and applied mathematics, and in health sciences, which has now been running for a couple of years, and we have produced quite a number of graduates. We came up also with a master's in natural and applied sciences, which only started this year. And of course, PhD programs in mathematics, PhD in maths and in statistics, and in health sciences. These programs all started this year. They're running as I speak. So it was a great achievement, and I feel so honored to have been there to see this progress go through. Now, coming to nutrition, this was, when we started this program, it was really dear to our heart. I personally took the interest to actually come out and to find out how many nutritionists we had in the country. You'll be shocked. I couldn't count a handful. And I say to myself, but this is a very important area. The whole nation needs it. Why are we having so few? So when we started this program, we really went through a rigorous process to ensure that, nothing goes wrong. And I'm glad that the WHO worked very closely with us. I shouldn't forget any of the people that that helped us. The World Food Program. So it was more of a teamwork, and UNICEF. So it was a team, and we worked very closely together to make sure that we come up with this program. And the first cohort of the nutrition students are in their 4th year now. And I think some of them are in the audience right now. And I'm so pleased to see how far we have got. And they will be completing their studies at the end of this year. And we have, I think, a class of 28 at the moment. And guess what? From this year on, we'll be producing a similar number until Namibia says, hold, we have enough. But I think that time won't come because we always need to generate, manpower. So that's how far we have gone. Now, the students that will be graduating, they will be graduating with an honors, which means they can hook on to master's programs and PhD programs which are already running in the faculty. So the road is already paved for them. The road is already paved for Namibia to produce its own nutritionists to the highest level. And this is why we are gathered here today, to see what road we have walked and how far we have got. Now, there are future plans in this regard that NAST is planning to have a center of excellence in human nutrition in the Faculty of Health and Applied Sciences. And these are some of the areas that this center will be looking at: research and development, training, and also to be a hub of knowledge in nutrition, dissemination of knowledge in nutrition, and of course, scaling up nutrition in the country. I've taken you through the journey that we have gone, and I'm so happy that we have walked this journey. There was a great team of people that worked through this to where we are today. And I can't help it but to say that I thank God for the people that I had around me that worked with me to achieve what we achieved. I thank you. Are there any questions?
Thank you, Prof, for a good presentation. I was thinking now, what are your thoughts in terms of having or planning for a master's course in nutrition and so on, and then make it further, yes, and we can link it to the other master's in science courses as well. Thank you, Prof.
Thank you. I'll just go back on the slides and to point out. Okay. Maybe I was not clear enough in my presentation, but we already have master programs in health sciences. So health sciences covers all the areas of health. We also have a PhD which started this year in health sciences, covering all aspects of health science. So nutrition is included. So our graduates, once they graduate, they can hook on to the masters immediately if they so wish. It's already there. Yes.
Thank you so much, Professor Moyo, for your presentation. My question that I have for you is on the issue of dietetics. Most of our hospitals don't have any dietetics that plan the meals of the patients. And I was wondering whether NAST will be able to include that program for students that are more interested in dietetics.
Thank you very much for the wonderful question. And I will not beat around the bush, I'll go straight. I must admit that in our planning, we really didn't look at dietetics. The problem, I think how do I put this? The main reason could have been that the main of the people that we actually came across as we were going through the process of finding out who we had in nutrition were people in dietetics. And we thought that there was enough manpower. And also, in the needs assessments that we did, the feedback that we got did not actually look more into that area. Perhaps it was a foresight, lack of foresight on our side. But now that you are mentioning it, I'll take the message back to the faculty. And I believe that maybe if we work together, we can work out something if there is a need in that area. I hope I've answered your question. Yes. Thank you.
Okay, Prof, a very simple question. I work in the rural areas with communities, and I feel learning in the classroom is quite distant from the reality outside. We have a huge population facing challenges with nutrition, nutritious food supply, and so on. Question is, how far is your program integrated in realities of Namibia's challenges? Is there any link? Are students exposed? Do you only produce capacities who work at high level, or have you also capacities who really make an impact with the majority of people in the country? Thank you.
That's a mouthful and a very good question. If we are going to be meaningful as a program and have NAFSAN, our really goal is to ensure that we take the message on nutrition down to the grassroots. If we don't do that, we have not achieved anything. When we talk about malnutrition and stunting and all these problems that are associated with it, that is where it is found. And if we don't reach that far, then we will have failed in our duty. And that's why in our planning, we, apart from our students, they can tell you, one of the things that they do in their third year, they do work integrated learning. Is it third year or fourth year? Yeah. Fourth year. And the idea is for them to actually touch base, when it comes to that. So there is direct influence. They are working. They will be working with the community to try and talk on issues of nutrition. And as we get more and more, through the program, there will be more and more infiltration of nutrition in the communities. But not only that, I talked to you about our future plans. And if you recall, one of the areas that I touched about concerning the Center of Excellence that we are planning to have is actually the issue of dissemination information on nutrition. Not only that, but of course, be proponents also of scaling up nutrition. Now, I believe that such a center would work very, very closely, more or less hand in glove with NAFSAN and all the major stakeholders, of course the Ministry of Health, no doubt. And I hope the Ministry, sorry, I'm not putting you on the spot. I hope the Ministry is ready. Now NAST is prepared to give you graduates in nutrition. Are you ready to receive them and deploy them? That's the point. And that's where now we can start disseminating these experts into the communities and drum up nutrition. I hope I've answered your question, sir.
Yes, thank you.
Thank you very much. Thank you.
Nutrition, 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 nutrition.